Good morning. As Sandra said, my name is Jason Cruikshank, and I'm from Vancouver Island, city of Victoria, where we have a Eaton Arrowsmith school. I'm very pleased to announce our next speaker, Dr. James Brad Hale. He is a professor in the faculties of Education and Medicine at the University of Calgary. Dr. Hale has over 20 years' experience as a special education teacher, school psychologist, and neuropsychologist. He has extensive teaching and clinical experience in universities, inpatient, outpatient settings, and public schools. He's pursued multiple lines of research, including specific learning disability subtype differentiation, challenging assumptions about IQ validity, examining characteristics of children with right hemisphere specific learning disability, and exploring neuropsychological aspects of ADD and medication response. As principal investigator of brain gain, Dr. Hale is focusing on conducting research that makes neuropsychological assessment relevant for intervention in schools and in medical settings. Dr. Hale is an active researcher, practitioner, presenter, and author, and has numerous scholarly publications, including his co-authorship of the critically acclaimed best-selling book, School Neuropsychology, A Practitioner's Handbook, and it's available at the Odin Books booth next door. I had the great privilege of meeting Dr. Hale 2 years ago in Victoria when he visited our school and spoke with our students, and he was also the commencement speaker at our graduation ceremony. Dr. Hale, it's great to see you again. Welcome. Dr. Brad Hale.
Thank you. It's good to see you. Okay, good morning. How's everybody doing? Okay, I'm not going to make you get up and do exercise, although it might not be a bad idea. I've been trying to, take the suggestions of the scholars and do exercise lifting pints, and it's not working. What can I say? I'm one of those non-responders, I guess. But lifting pints is obviously not the way to do it. So thank you for coming, and it's great to see such a wonderful audience. And I'm going to tell you a little bit about the brain today, and we're going to focus on neuroplasticity and the importance of it. You know, it's interesting, as Jason was going, and thank you for that wonderful introduction, Jason. As he was reviewing my history, I started out as a radical behaviorist and a special education teacher. And I taught 7th and 8th grade. And after that, I decided to study hormones. The reality is I was not successful in teaching all of my students, and I didn't know why. And that drove me to a career in neuropsychology and away from my behavioral roots because I was very dissatisfied with how Skinner dealt with individual differences. And so I say that as a premise to my talk today because I want you to know that my roots were in the trenches, were in the classroom, and I know there's many. How many teachers out there? Wonderful, wonderful. And I knew I didn't know enough, so I wanted to learn more. And that has led me to embark upon this career of trying to make assessment relevant for intervention and understanding individual differences. So without further explanation, let's get into the talk. Okay, so serving children in the schools, why haven't we done a great job at it? Well, one of the things is teachers' issues. There's been a kind of a scientific void in many education departments for many years with kind of a deconstruction mentality about science that we need to erase all of it and construct our own educational experiences. That's wonderful. It's certainly good for valuing children, but when we avoid the science and the empirical evidence that can guide our practices, I think that limits us as teachers. We're often taught about multiple intelligences. If I said, how many people in this room have heard of multiple intelligences, everybody would raise their hand, right? But the reality is multiple intelligence is actually not empirically based. The idea behind multiple intelligences is a good one, but the reality is we haven't had good science to understand multiple intelligences. So although I respect Dr. Gardner, his approach is one in which really the value of it, why is it so popular if there isn't science to back multiple intelligences? And the reason is his approach has wonderful humanistic cachet. If you think about it, it's about valuing children, isn't it? And that's why we're all here today. Well, some of you may be adult folks, but that's why I'm here. The causes of learning problems. Many teachers only get limited training in understanding individual differences. And when you think of a child with a learning disability, there are multiple causes of learning disability. And that's with the step where we need to go. A child with a learning disability doesn't really tell you what you need to know to help that child learn. Teachers use a trial and error approach to understand how individual differences are related to intervention. And that trial and error approach might be taking valuable time away from what we can do to help a child. And finally, training and support for teachers in diverse learning needs is essential practice, and we all know that. Everyone in here would say we should value diversity. We should recognize the importance of serving children with diverse needs in our classrooms. But the reality is, all the research says one thing: we need more training, we need more experience, we need more help. Because in that way, most teachers would be comfortable with inclusive environments. Well, then we often think about school psychologists or educational psychologists, as some of you referred to them as. School psychologists also have limited training in individual difference, and there's been kind of a movement away from the roots of clinical psychology to a more behaviorally oriented approach. Very few school psychologists have an understanding of the neuroscience of learning. That literature has been largely void in the school psychology literature for some time. And as a result, the school psychologist has often been called in to test and place children. The school psychologist often evaluates their children based on a numeric approach or a nomothetic approach. And that, as a result, leads to evaluations that are about entitlement decisions or whether a child has a disability or not what we can do to help a child. And that is where we need to change. So one of the things we've been doing at Alberta Ed, I'm at the University of Calgary, is we've been trying to reconstruct the curriculum for the whole province. Anybody from Alberta out there? Okay, good. We've been involved with the folks in the Ministry of Education there in Alberta now for about a year and a half. And we have been working, my team at Brain Gain and I have been working at developing a curriculum that's brain literate. So a curriculum that is based on brain functioning or our understanding of brain functioning in relation to the curriculum. So what an exciting experience it was for us last spring, going up to Edmonton and working with all these curriculum specialists for all over the province and saying, you know, here's what the brain issues are in relation to the curriculum ideas that you're coming up with. And we worked diligently to kind of work at refining that curriculum, which is now being piloted in Alberta. It won't be rolled out for a couple of years, but I'm very excited to say that we are probably the first province and maybe the first major school educational organization worldwide that has a curriculum that is based on, in part, brain functioning. Yeah, very exciting. So, thank you. So, you know, what we need to do is we need to think about the neuroscience of learning and behavior. We need to know that the brain changes. The brain changes much quicker than we ever anticipated. That's one of the things, I mean, a couple of the speakers before me had said stuff about, you know, we thought no new neurons were born. We thought, when I went through my neuropsych training back in the dark ages, a couple of years ago, they really said that, basically we were dealing with hardwired pathology and there wasn't much we could do to change. With the revolution of neuroscience, what we've realized is that the brain changes in remarkable fashion. It basically will reconstruct itself. And this brain matters for disability identification and ability identification. What my goal is for some of the rest of my career is really to focus on how we can make the brain meaningful for education for all learners. Wouldn't it be really cool if every educator went through brain training? And one of the things that brought me to the University of Calgary, I was recruited from the University of Victoria. People say, why would you leave Victoria for Calgary? Because of the incredible opportunity I've had there, working in the medical school and working in the faculty of education as well. And really, what we're doing is we're not only training psychologists in neuropsychology, but we're training educators. And one of the things that's so exciting is I teach in the master's education program there, and I had a class of 375 students, all training to be teachers. 375. And they loved it. They said, why isn't every one of our classes about this? Because it's about the brain that we do. That's what we do as educators. We teach the brain. It's not the heart, it's not the lungs, it's not the elbows, it's not the knees. We teach to the brain. And your job as educators is to change brain functioning. Okay? So when you think about it, we have three realities that we must recognize. And they're simple, but we need to recognize the brain is the organ responsible for learning. We also must realize that children with disabilities process information differently than typical children. Disability is not just the lower tail of a normal distribution. What neuroimaging research has confirmed, which we have established in neuropsychological measures as well, is that children with disabilities use different areas to process information in their brain. What does that mean for us as teachers? What does that mean for us as psychologists or physicians or other practitioners out there? That means that we can't interpret the scores that we get on our measures, the performance that we see on our tests, the same way for every child. And that's a little scary for us because what we'd like to think of is, let's say the average on a test is 100, right? And so 130 would be really good, and 70 would be really bad. But the reality is, I can show you children who get 100 on a particular test who have a significant disability. And you say, how could you do that? It's average. And the reason why is because they are able to use other areas of their brain to compensate for the problem. And that is why a nomothetic score-based approach to understanding disability is very limited. Because what we found is that children with disabilities use different areas of their brain to process information. Some of them successfully accommodate their learning differences, others struggle. And so what we need is we need a lot of research to really say, what makes this kid compensate effectively? How does this child use the other areas of their brain to compensate successfully? And does that vary by developmental level? But the reality three that we need to focus on today in the talk is that teaching changes brain functioning. And that is something that I want you guys to all walk away and think about the next time you go into your classrooms. Because the reality is that teaching does change brain functioning. When you take a child from September and then let them go at the end of May or in June, their brain has changed. As you've heard today, The brain is rewiring. It is plastic. It is adapting to the environment. And so the brain does change in response to environment. Oh, there's a screen down there I can read. I wondered what I was talking about. Oh, good. Talk about the brain changing. I've been down there the whole time, and I'm just seeing it now. Don't you dare evaluate me out there. Okay, so one of the things that you might have heard about, how many people have heard of response to intervention out there? How many people? Okay, so response to intervention is supposed to be the replacement for everything. And what we found is that how many people, let me just ask this question. No, this is a loaded question. But I'll just say that there isn't one research project anywhere where they have demonstrated that response to intervention is an effective way to diagnose learning disabilities. There isn't one. And yet governments, I know here in BC and Alberta and in other parts of the world, especially the United States, have been advocating using a response to intervention and getting rid of cognitive assessment and neuropsychological assessment for understanding learning disabilities. What we found, and I can't go into detail today because of the limited time that I have, is that response to intervention is great for a lot of things. Preventing disability. Okay? Preventing disability. Early intervention is critical. So what we suggest in my model is that we use a standard protocol RTI approach and curriculum-based measurement to monitor child progress early on. But this is not sufficient for identifying a disability. So what we would try next is a problem-solving approach. The problem-solving approach is where we're now modifying curriculum and instruction and intervention techniques to try to get the child to respond to our academic interventions. If the child is not successful, maybe we need individualized special education. But what we differ from the RTI folks in saying is that what we need is a comprehensive evaluation. A comprehensive evaluation is a necessary component to find out why a child is not responding to our interventions. And that comprehensive evaluation needs to be much more thorough than what we've done in the schools. What it needs to encompass is what we call hypothesis testing. We need to be able to evaluate a child, look into why they're failing to respond to intervention, and then develop appropriate interventions for them. So one of the goals of my work is to establish the validity of this. And what we have done is we have shown that if we do RTI right, you can prevent or use early intervention to serve about 80% of kids. So you can reduce your special education rules quite a bit. That's what RTI is effective at. Because what we know about brain plasticity is it works both ways, as I'll talk about in a minute. So we have to be into early intervention. In many schools, they say we won't evaluate a child till age 3 or till grade 3. And that's too late. That's too late. You have to stop that. Okay? Because what we know is the brain, well, I'll talk about it in a minute, but what we know is that early intervention is critical, and that's what RTI can do. So although I'm going to say that response to intervention is not an effective approach for identifying disabilities, I will, on the other hand, say it is critical, and I think we should mandate it. I think we should mandate it because we have to reduce the number of children evaluated, we have to provide early interventions for them, but then those kids who don't respond need a brain-based evaluation. We can be much more thorough in evaluation if we use early intervention to prevent disability. So this is what RTI says. You didn't respond, throw you into special ed. We got to find out why they're still struggling. And that is where neuropsychology comes into play. Now, I'm not going to go into detail about this, but we have an approach for non-responders, kids who don't get better with early intervention, called the cognitive hypothesis testing model. When we do this, we don't give a standardized intelligence test or cognitive test, an achievement test, and a behavior rating scale. That's not sufficient. What we found is that you need to test out hypotheses derived from that intelligence test profile. Because the alternative, which is scoring up the test and giving you the numbers and doing ability achievement discrepancy to identify a learning disability, is extremely problematic. Ability achievement discrepancy needs to go. It's an ineffective way to identify learning disabilities. Okay? And so usually I get people to walk out of the room at this point. Because I'm going to tell you another thing. IQ is the greatest myth in psychology. Thank you. IQ doesn't measure ability. It's a conglomerate of a whole bunch of different cognitive processes that we collapse and throw it together and say that's their ability. If you know how to measure ability, I want to see you after my talk because I would love to know how you do it. And I've evaluated over 1,000 children. Okay? So if you know, let me know. All right. So did I get anybody to walk out yet? All right. So what we're doing is, in traditional practice, it's this one on the left. The psychologist doesn't know the kid. Nobody knows the kid. It's all about numbers. It's all about tests. It's all about scores. To really understand Charlie, we need to evaluate them more thoroughly. The only way we can put the time into more comprehensive evaluations in children who don't respond to intervention is to do RTI and to do it well. So I said in 2006 we should mandate RTI, and I still believe that. But the idea that a child who doesn't respond to intervention is now learning disabled is extremely problematic. And let me just give you a little understanding as to why. Think about it for a minute. If you don't do something, you are something. Something wrong there, isn't there? And if you think about it, every person in every cemetery here in Vancouver is learning disabled in an RTI model. Why? Because they don't respond to your interventions. Okay? Think about it. There's a scientific error there, isn't there? In saying a kid who doesn't respond to our intervention is now LD. So brain development in children. Let's think about this for a minute. What we know about kids is that brain development continues well before birth. You know, playing Mozart on your tummy, it might work. You know, the research isn't all that supportive, but the reality is kids learn very early on. And there's now research happening about stress during pregnancy. You know, when you think about stress during pregnancy and how that might hardwire kids' brains to not function well because of stressful pregnancy. We've known about illness, but have we really looked at mental illness during pregnancy? Not as much as we should. We know that the first 5 years are critical, and the back of our brain develops before the front of our brain, and that front of the brain is the last to develop. One of the things you might want to think about is emotional intelligence. Everybody's heard about emotional intelligence. Well, the reality is the uncinate fasciculus, which is a white matter pathway between the emotional part of our frontal lobes and the temporal lobes, is the last to develop, and it doesn't develop till 30, around 30 years old. So think about what that means for attachment and bonding and relationships. This is straightforward, but the brain does not mature at the same rate for every individual. Third graders are not the same across the board. And one of the things that we know is that these brain pathways and neurons continue to branch and develop throughout life. But at the same time, we're doing what's called pruning. We actually destroy more brain tissue than we create. And the reason why is it's all about carving pathways. Brain plasticity is not only about recovery of function following an injury, that's what we were taught early on. It's really about carving effective pathways. And when you think about it, more is not better in the brain, more efficient is better. And that efficiency is environmentally determined. What we know about brain plasticity is that the brain is much more malleable than we ever thought, as I said earlier. But the reality is it's about a goodness of fit between the child and the environment that creates these pathways. So when you think about plasticity, it can also go wrong. The brain can adapt to dysfunctional environments as well. Brain plasticity isn't just positive, unfortunately. Brain plasticity can go the other direction. In other words, if you learn the wrong things because your environment is not serving you well, your brain will rewire itself in a dysfunctional pattern. And that is why early intervention is critical for serving children and their needs. Because if we allow a brain to practice mistakes over and over again, it ends up, those pathways end up dysfunctional. And then when we put a child in another environment, it's often too late. The problem is resistant to intervention. So when you think about it, we're not going to evaluate anyone until 3rd grade. Oh my gosh. We're allowing that brain to wire itself wrong. And that brain is wiring itself wrong and more wrong and more wrong and more wrong. And now, 3rd or 4th grade, when we finally get to the evaluation, it's almost too late, isn't it? Because it's adapted itself to the environment in a dysfunctional way. Okay? So when you think about it, the brain is remarkable in its ability to adapt and change. As you can see, what we end up with is a brain that's exceedingly complex. And what you have is a lot of white matter development, and that white matter development is what creates the complexity of thoughts and behaviors that we see, and we'll talk about that more in a minute. So there's some basic tenets of neurodevelopment we need to think about. One is the mistake that a lot of us who get into neurology or neuropsychology think about, and that is the environment or the brain. Is it one or the other? Well, think back to your basic psychology class. Nature, nurture. What did you guys conclude? It is both. So even if we have clearly a brain-based dysfunctional a child with brain-based dysfunction, the environment plays a critical role, doesn't it? And knowing that it's inextricably related, if we get too focused on the cause of a problem instead of what we can do to help. And so we need to focus more on intervention. Many learning and psychological problems have neurodevelopmental causes, though. Okay? Almost all the disorders we see in our classroom have a neurobiological basis to them. And so we need to kind of think differently about, this is because of poor parenting. Poor parenting, if that is indeed the case, can hardwire that brain in the wrong direction. Dysfunctional patterns within a family can make the brain go a different way. And a great example is post-traumatic stress disorder. Post-traumatic stress disorder, which is the result of verbal or physical abuse, people would say, that's environmental. The causes of that child's memory problems are environmental. But what we know looking at the HPA axis is that children who have experienced trauma in their lives, actually their brains get hardwired the wrong way. So it doesn't do us any good to say it's either due to the environment or due to what's intrinsic to the individual. Brain plasticity has taught us that it's interrelated and inseparable, and they go in both directions. Whoop. So one of the things is we need to think about is that the brain will adapt to that environment in both ways. Plasticity, again, will create functional pathways if we do the right types of intervention. But if we do the wrong types of intervention, the brain will get worse. If we allow a child to engage in a dysfunctional pattern, that will result in the child hardwiring that dysfunctional pattern. So we need to think about the brain's interaction of cognition, behavior, and environment in a reciprocal fashion, as Bandura taught us many, many years ago. I like to bring up Bandura because he's the guy who took me away from Skinner. But I mean, it's a great way to think about it, this interaction of cognition and behavior and environment. And another book, I thank you for having my older book, School of Neuropsychology, out there, but we just published a book in APA by the American Psychological Association Press that just came out. I'll show you at the end of the show, which we don't have a copy of here. But one of the things I'm excited about is the last chapter. The last chapter, what we've talked about is how this hardwiring of dysfunction can occur if we're not careful. So I'll come back to that later. So let's talk about the brain. I mean, you know, if you have to think about what the brain does, the brain has 5 major components: touch, vision, hearing, all in the back of the brain, and motor functioning in the front, plus the maestro, the brain boss, what we know as of executive function. You know, one of the exciting things to see in my lifetime is when I gave talks to audiences like this in the past, and I'd say executive function, people wouldn't know what that is. And now most people have heard of executive function, but we're limited still, and I'll talk about that in a minute. Okay, so I keep hitting the wrong button. All right, so let's just kind of recap what we know about the brain. You know, A.R. Luria was a famous neuropsychologist who's passed away now, and his enduring ideas stick with us for many years now. What we know about the brain is that the brain has 3 major components. The one for being alert and awake, that's one that doesn't affect us as much in the schools, but certainly when we talk about health and exercise and diet and so forth, that we could have an influence on that. But the back of the brain is the unit for receiving, storing, and analyzing information, whereas the front of the brain is important for regulating, verifying mental activity. So one of the things that we think about is these 3 functional units. The functional organization of the brain is it's hierarchically organized. So it starts at a very simple level and gets more complex as we go up the brain. It becomes less specific as we go up this hierarchy. So as you go up the hierarchy, the neurons do many more things. And the brain becomes more lateralized in function. In other words, the left and right hemispheres do different things. So a visual representation is it here. We get the sensory information coming in either through touch, auditory, or visual functioning, and it gets integrated here in what Luria called the zones of overlapping. That is the area where comprehension occurs. That is where we understand things. And these neurons do many different things. That's why we get what's called comorbidities so often. Comorbidities are more than one disorder at once. It's because these zones of overlapping are the last areas of the brain to develop, okay, in the back of the brain. Then we have the frontal lobes, which are the brain boss. They govern all aspects of cognition, including the back of the brain. This, what Luria called the brain superstructure, is what allows us to have volitional behavior. And then you have the motor cortex as well. Now, it would be great to say, is a child's problem due to the back of the brain, or is the child's problem due to the front of the brain? Is it more an input problem in the back of the brain, or an output problem in the front of the brain? The problem is these areas are so connected with what's called white matter that they are difficult to separate out. Instead, we need to think of what Luria's student Goldberg said is it's a how much question. Localization of function in the brain or particular parts that do only one thing doesn't work. Instead, we need to think about brain systems and those systems and how they connect. So when you think of the back of the brain, you have where senses are processed and vision is processed, and let's just throw all this up here for you at once. What we have is we have sensory input in the parietal lobes, we have visual in the occipital lobes, and we have object processing as well as orientation and spatial processing, and then semantic processing in the temporal lobes. I'm sorry, this is a lot, but let's just try to get through it, get a basic understanding. For instance, we know that long-term memories of facts and details are largely located in the left temporal lobe. Okay? And what we know about that is interesting because if you think about it, let's just talk about a practical application. If you have a child who has difficulty with facts and details, it's probably their left temporal lobe that is struggling. But one of the things you want to think about here is the difference between nouns and verbs. Guess where verbs are? The part of the brain that does things, in the frontal lobes. So whereas understanding facts and details is in the back of the brain, verbs is in the front. So if you think about it, some children have problems with action words. Some children have difficulty with facts and details. And separating those out in your sentence writing or in your comprehension could be of worthwhile to you. Finally, what's interesting here on this slide is look where you have the supramarginal gyrus, the angular gyrus, and receptive language all in one spot. Guess what area that is? That's the zones of overlapping. And guess what happens there if you have a problem in all three areas? You have problems with receptive language, you have problems with math computation, and you have problems with decoding, sound symbol association. Because that zones of overlapping, remember, those neurons do a lot of different things. So that's how you can have a kid with language problems, reading problems, and math problems all in the same child. It's because those zones of overlapping are impaired. Now let's switch gear. This is just a representation of the dorsal and ventral streams, and I want to highlight this quickly for you. One of the things that's interesting about reading, as we'll talk about in a minute, is some kids will read using their dorsal stream, which is one that is more related to spatial and detail focus, and other kids will read using their ventral stream, which is for sight words. So whereas the dorsal stream is responsible for decoding words, the ventral stream is important for sight words. I'll come back to that in a few. What's interesting is they're also connected through the superior temporal sulcus stream in the brain. But think about that next time. Just because a kid can recognize whole words doesn't mean they're going to be a good reader. I'll come back to that later on. Okay, and so now the frontal lobes. Let's talk about the frontal lobes. The frontal lobes, what we're finding is that the frontal lobes are important for a lot of different things. You ever have a child in your classroom who gets it right one day and then forgets it the next? Okay. One of the things that a lot of people will, I'll meet a teacher and the teacher will say he has memory problems. He gets it one day, then he doesn't get it the next. But one of the things I ask a teacher is it a problem with encoding, storage, or retrieval? Encoding is getting it into memory. Storage is actually storing the memory. And then you heard about the hippocampus earlier. It's important in both storage and retrieval, encoding and retrieval. It's not where memories are stored, though, however. Okay, so working memory, memory encoding, and retrieval. And it looks like the left hemisphere is responsible more for encoding, and the right hemisphere is more important for retrieval. So one of the things you have to ask yourself for a child with memory problems is it more a getting it in? Is it actual storage? Or getting it out? And there's different interventions for each. For instance, parent associate learning is good for encoding, attaching a known word with an unknown word. Retrieval, a cue hierarchy. You don't just move on to the next kid when he doesn't get it right. You try to cue his memory, which will facilitate retrieval. So this does lead to intervention when we think about it. Obviously, the frontal lobes are important for planning, organizing, strategizing, monitoring, evaluating, modifying, and changing your behavior. It's the brain boss. These are executive functions which we often think of. What's this critical for? If you look at what this definition of the frontal lobes is, especially the dorsolateral prefrontal cortex, what do you think of? What academic area do you think of? Anybody know? Anyone want to take a guess? Writing, of course, that's exactly what you do when you do written expression. So think about it, that's the act of writing, isn't it? So kids with frontal lobe dysfunction have difficulty with writing because that is all the tasks, all the constructs that are required to be a good writer. Now this will be a shocker for you. The frontal lobes are responsible for attention, concentration, and impulse control. Now why do I say it's a shocker for you? Because I'm here today to tell you children with ADHD do not exist. No, don't go there yet. Attention deficit isn't the problem with ADHD. The problem is in brain boss executive control of attention. Okay? There's a difference. And so it's the brain, that's why an ADHD kid can focus very well when they're motivated or interested in something, or when they're engaging in vigorous exercise. Okay? Like you heard earlier. Because the brain boss control of attention, which is more a back of the brain problem, attention problems, basic attention problems are in the back of the brain. So ADHD doesn't exist because it's really what Martha Denkla says is we should call it intention deficit hyperactivity disorder. Because the hyperactivity and impulsivity lead to our executive function problems, and also attention control is the problem, not basic attention. So that's why kids with ADHD, the true ADHD, which is a frontal lobe problem, can have problems controlling their attention. And that's why the medication works. It's because it wakes the brain boss up to control the rest of the brain. You guys hear the old saying, while the cat's away, the mice will play? You guys have all heard that, right? While the cat's away, the mice will play. That's ADHD. And what the medication does is it wakes the cat up. The medication works because it wakes up the brain boss so that it can control the rest of the brain. So when I say ADHD doesn't exist, I don't think it does. At least the combination of impulsivity, hyperactivity, and attention. And Russell Barkley, who we disagree about other things about, and I would agree with the fact that ADHD inattentive type without hyperactivity or impulsivity is probably not ADHD. It's probably not ADHD. A lot of those kids have what we call comorbid depression or anxiety. And what I ask you today is it really ADD with anxiety and depression, or is it just anxiety and depression? Because kids with anxiety and depression also have problems with attention. Okay? There's another primary attention deficit that's due to the parietal lobe dysfunction. That back of the brain problem is the source of primary attention problems. So that's another cause of attention deficit, but it's not the ADHD that responds to treatment, at least medication treatment. Okay, so the brain boss controls all aspects of cognition, and that is the problem in all psychopathology. All psychopathology has been related to frontal lobe dysfunction at some level. So autism, ADHD, depression, anxiety, obsessive compulsive disorder are all brain boss problems. So an oversimplified, and make sure if you're taking notes you put this in there, an oversimplified representation of disability is that the back of the brain is more involved in learning disabilities, the front of the brain is more involved in psychopathology. Again, it's an oversimplification because there are frontal lobe problems that lead to learning disability, and there are back of the brain problems that lead to psychopathology, but it's a nice distinction, isn't it? If we have a child where we think it's more an output or executive problem, we're thinking more psychopathology. And if it's more an input problem or a back of the brain problem, we're thinking more learning disabilities. Okay? But again, it's an oversimplification. Don't walk away saying it's one or the other. Okay, so when we think of the back of the brain to the front of the brain, that's one thing we need to think about in our classrooms. Is if it's a back of the brain problem, it could be an input problem. If it's a front of the brain problem, it could be an output problem or executive functions. That's always important to discriminate in our instructional techniques. But the other thing to think about is the left and right hemispheres. And we have really changed what we think about when we think of the left and right hemispheres. What do people think about mostly when you think of left and right hemispheres? The left is what? Verbal. And the right brain is nonverbal. That's wrong. It's clearly wrong. Erase that from your brains. Rewire those connections. Let's be plastic here. Because I'm here to tell you today that that is a wrong conceptualization of left and right hemispheres. It's not accurate. So let's look at the early thoughts about the left and right hemisphere. We thought the left brain must be leading and the right brain would be automatic. Nothing further from the truth. Nothing further from the truth. How about major and minor? Like that left brain's really important and that right brain, we don't know what it does. No, that's not either. This is one that drives me nuts, and the physicians in the audience will get mad at me for saying this. But dominant and non-dominant, why do we use those archaic terms? You know, left brain is dominant, like the boss, and the right brain is non-dominant, the follower. It's inaccurate. Verbal, nonverbal, erase it. It's wrong. I guarantee you, plenty of research to rewrite that. Analytic and holistic, that's a little bit better. Certainly, the left brain is into part in analyzing things. It's into successive and sequential processing of information. The right brain is much more holistic and simultaneous. It likes the big picture. Okay? So the left brain is much more, it's our OCD side of the brain. You know, we live in our left brains, we're very detail-oriented and very sequential. Piece by piece, we go through the world. The right brain says, don't worry about pieces, give me the big picture. Okay? Local and global. I'll show you an example of this slide later. But there's been lots of research now that shows that neurons in the left hemisphere are very focused on parts of stimuli, whereas the right brain is much more a vague processor of multiple areas. And we think of hemispheric differences, that's important. Finally, we have routinized and novel. The left brain likes what it knows. The left brain likes novelty. Okay? The right brain likes new things, which is important for learning, isn't it? And the left brain likes what it knows. So when you think about it, why? Why do we have these differences? Well, one of the reasons is, you guys have all heard of gray matter and white matter, but a lot of people go like, what does that mean? Gray matter is more, the analogy I like to use is it's more like cabinets, closets, rooms, houses, buildings. Okay? So it's all about storage areas. And that's why long-term memory is more a left hemisphere function than a right hemisphere function. On the other hand, the right hemisphere is more about white matter. Now, what do we think about white matter? White matter is those myelinated axons. And what we find is those white matter pathways are more common in the right hemisphere. And what we know relative to the left hemisphere. What we know is that white matter is more like roads and paths and hallways and highways. It's all about connecting things. So now you're starting to get a picture of why the left hemisphere has more of that piecemeal primary cortex and association cortex is more common in the right. And we know that we have more within mode, so within vision, within hearing, within tactile, within motor in the left hemisphere, but the right hemisphere is much more about integration. It's all about intermodal connections, being able to cross different ideas and perspectives. So the right hemisphere is much more into this big picture, isn't it? And the left hemisphere is more detailed. Now think about curriculum for a minute in our schools. Where do we focus on the left hemisphere? In elementary school or high school? College? The left hemisphere is what early elementary school is all about. Getting those facts, getting those details. The right hemisphere, on the other hand, is much more important in high school and college and in real life. Okay? So let's give you an example of why the idea of verbal and nonverbal needs to go away. Think about it for a minute. He stopped at the bank to make a deposit. What does the word bank mean here? Financial institution, right? Because we make deposits in a bank. And the left hemisphere is specialized for that kind of explicit, straightforward language. But let's think about this sentence. He stopped at the bank because he had to stay dry. What could the word bank mean here? Well, this is a much more uncommon use of the word bank, isn't it? So it could mean a lot of things. And a lot of people who stay in their left hemisphere say, well, it's raining out, so we go in the bank because it's sheltered. Or if you stay in your left hemisphere, say, well, you go in the bank because you got to get some money so you can go buy an umbrella or you can go get a raincoat. Okay? But what we're really talking about here is it's a river bank. Because if you don't keep going, you will fall in the river and you will get wet. Okay? And the right hemisphere is what will pick that up. The right hemisphere deals with implicit language. And you say, well, geez, why did we think the left hemisphere was all language? It's because all the people that wrote the speech and language pathology tests, any speech and language pathology people out there, don't raise your hand, made them left hemisphere language tests because they only dealt with explicit language. That's why early conceptions of the brain thought it was left hemisphere, because you'd have a left hemisphere stroke, and then the left hemisphere would be damaged, and then they wouldn't do well on the speech and language tests that were all about explicit language. So what's implicit language? Implicit language is metaphor, okay, humor, sarcasm, innuendo, indirect meanings, multiple meanings. Inferences require right hemisphere functioning. Looking at probabilities, we've seen that in math. Probabilistic thinking is right hemisphere thinking to an extent. What's the probability of all possible combinations that the right hemisphere will be, or that this is the answer to the question? So really, what's more complex, the right hemisphere or the left? Think about it for a minute. Certainly not automatic in that right hemisphere. So let's think about language, some more. Different aspects of language are processed in both hemispheres. When you think about it, what the details of language, certainly phonemes, are more left hemisphere. But prosody is more right. Okay? So the same areas of the superior temporal lobe process different aspects of language. You ever have a professor who talks like this and says the same thing no matter what because they always talk the same way? Okay? That's more left hemisphere types of language. Very detailed, very specific. Now, on the other hand, if you could talk in an animated way and express your emotions in such a way that it really conveys how you're feeling. I still have some right hemisphere functioning. But maybe it's become routinized, who knows? Okay, so when you think about it, even language, it goes both ways. We talked about close semantic versus distant semantic relationships, but think about it, even syntax, which is very rule governed, right, in language? Syntax is all about rules, grammar, rules, punctuation, periods, clauses, and all that stuff. Simple syntax is left hemisphere, but complex syntax is right. For instance, this presentation ends at 12:15, unless I'm not done yet. And then we're barring the doors shut. Okay? That's an example of a modifying clause that if you're left hemisphere driven, you're going to try to bust your head out the door there. You may do that anyway, who knows. Now, here's the best theory down here, because I wrote it. Concordant, convergent is what our left hemisphere specializes in. An apple and an orange are both fruits. So our left hemisphere likes correct answers, doesn't it? How do we come up with the synthesis to bring it all together? But the right hemisphere is much more interested in multiple ways of thinking and multiple perspectives, i.e. creativity. Okay? An apple and an orange are different because one has a peel you eat, the other doesn't. An apple is red and an orange is orange. Okay? So the right hemisphere thinks of multiple discordant divergent processes, and the left hemisphere thinks of only one. So one of the things we have to think about in terms of hemispheric functioning is not this verbal-nonverbal dichotomy, but how each hemisphere cooperates in the tug of war between solving a problem and thinking of another way to do it. So think about it in terms of your education. People get too left hemisphere focused. They may get the right answer, but if they don't, can they think of another answer? So one of the things we do for intervention is encourage either left or right hemisphere functioning based on the type of problem they're displaying. So when you think about it, we have all these processes in the left hemisphere, and we have all these processes in the right when it comes to language. So as you can see, the left hemisphere and right hemisphere both do language, but for different types of language and different aspects of language. So the verbal-nonverbal dichotomy is dead. Okay? So when you think about it, it applies to faces. Have you ever seen this woman before? No. So your right temporal lobe processes that. But think about it. Have you ever seen this lady before? I think we have. And it's your left temporal lobe that responds to known images. So visual doesn't follow the left-right thing either. Okay? Because we know the left hemisphere deals with visual detail and what it knows. And the right hemisphere deals with spatial aspects and novel images. Okay? So again, nonverbal doesn't go that way either. So facial perception, it depends on your familiarity with the person. Today you might have met some strangers who give you facial expressions. And you kind of go like, well, what does that mean? Okay? What do you mean by that? On the other hand, think of your significant other when you said, I have to be at a conference at 7:30, and they looked at you like, really? And you said what? Don't give me that look. I know exactly what that means. That's your left temporal lobe. That's your left temporal lobe that knows your partner's facial expressions inside and out. And that's how people who are in love can communicate without ever talking. Okay, so think about this in terms of details. This is a genius experiment that's been replicated several times by Dean Dellis down in San Diego. And what he did was he looked at people and he said left hemisphere damaged, right hemisphere damaged individuals, and I'm going to show them this stimulus. What he found was if you had left hemisphere damage, you're missing what? The details. So what did they draw? an L. And if you had right hemisphere damage, what were you missing? The big picture. So what did they draw? A bunch of N's. Okay? So again, we need to get rid of this verbal-nonverbal dichotomy and really start to think about the types of processes we request of our children in the classroom, the types of words we use when we communicate to our students, the types of questions we ask, and what brain areas we're tapping. And that's what school neuropsychology is all about. Is there evidence? There's lots of evidence. Newborns. You know, we thought that, oh my God, it's 5 after. Yikes. Is my clock wrong? All right, we won't get through the whole talk, but that's how it goes. Great example, newborns. Since it's novel, what we find is there's a lot of right hemisphere activation when newborns are processing language. So when you think about it, when you sit there with your baby, oh, you're daddy's little girl, you're the best thing ever. All the kid looks up at you like, going like, because the reason is all they hear is, they have to attach the symbols to the words you're using. And so all they read is right hemisphere types of activity until they understand those words. And new learning works that way with kids. When it's a novel thing, brand new, that right hemisphere is really engaged. Musicians, you know any musicians in the audience? No? A couple? What we used to think was because it's melody, it must be right hemisphere, right? You know, and so everybody thought, oh, that's right brain. No. What we know is expert musicians actually, because they're experts, process music with their left hemisphere. So a left hemisphere stroke will put a musician out of business. A right hemisphere stroke will not. Okay? Also, when you think about music for a minute, when does an expert musician use their right hemisphere? When they're improvising, when they're doing a solo, because that's creative. That's going to take the right hemisphere to do. And another example is ASL. We thought that signing must be a right brain thing because it's nonverbal, but it's not. Clearly, the same areas of the brain that process language in the left hemisphere are what processes it in the right. So what we know is novice is more right frontal, expert is more left posterior. And so what we find is that understanding those tertiary areas of the brain become much more important than input or output. And that's what we need to think about when we educate kids and we figure out what's going wrong with them. So here's a great way to think of the hemispheres. Okay? So, left and right brain, and I'm sorry. I talk too much. Think of my poor students who have to listen to this every week. And I'm like, we gotta hurry, we gotta get through this lecture. Okay? All right, left brain, routinized, detailed, local, crystallized abilities, prior learning, more left brain, novel, new thinking, more right, input in the back of the brain, output in the front. So let's switch to the frontal lobes for a minute, because that's the next thing. Everybody here has probably heard of executive functions, brain boss. What we're finding out, and this is the exciting area of research that's going on now, is there's different parts of the frontal lobe. There's the dorsolateral, the orbital, the oculomotor, the motor, and the cingulate. So different areas of the frontal lobe do different things. For instance, the orbital is all about controlling your emotions and behavior. The dorsolateral is about managing things and actually learning in your environment more. Watching things with the oculomotor, running and drawing with the motor, and finally the cingulate with decision making. Some people have problems making decisions or choosing between items. And you think about it, how can a multiple choice test be harder than an open-ended answer? It's because some people have difficulty making decisions between competing ideas. That could be an example of a cingulate problem. So what we're finding is different aspects of the frontal lobe have different aspects of functioning. So when you think about it for a minute, we've got front back, left right, and top down kinds of issues. And that, in a nutshell, is how the brain works. Okay? Easy, right? 5 minutes. I said I'm going longer. All right, so, well, let's just end there. Okay, but no, let me give you some final points to think about in terms of understanding how the brain works. So, the back of the brain is all about input. The front of the brain is all about output. Okay? The left brain, 2 things to think about: details and old ways of thinking. The right brain is about big picture and new ways of thinking. Okay? Finally, the frontal lobes, which is part of that front part, is the brain boss. There are multiple brain bosses. Different brain bosses have different kinds of problems. And guess what they all lead to? Attention problems. I didn't get a chance to share with you today in my presentation our research on ADHD. But I'm very excited by it because what we're showing is, not surprisingly, not all kids who have behavioral ADHD actually have the problem. And those kids who don't have that type of attention problem don't get better on medicine. So that's the first exciting thing. The second exciting thing is, remember I said there's 2 brain bosses, 2 major ones, one for kind of thinking on the outside and doing things, and then there's an internal brain boss about emotions. What we're finding is the medicine has different effects on each. Think about this for a minute. The best dose for a child's behavior is actually higher than the best dose for their cognition. And that's a little scary, isn't it? Because what do we always choose the medication on? Behavior. Guess what's impaired most often on high-dose stimulant medication? Working memory. Working memory in animal models and in our own research. My doctoral student, Hannah Cubis, down here, just published a paper in postgraduate medicine that showed working memory is likely to be impaired on high-dose stimulants. So the next time you're wondering whether a kid gets better on medication or not, don't only just look at the behavior, but look at their thinking as well. Because that is what's getting impaired on high-dose stimulants. So we're doing fMRI research. We're actually looking at brain imaging of these circuits in kids with ADHD, and we're hoping to change practice. We want to get physicians and psychologists and teachers to think about a child's thinking on medicine, not just their behavior. Okay, my final point is assessment related to intervention. We have to stop doing assessment and testing and diagnosis for diagnosis only. One of the things I would encourage all of you to think about is if you understand the brain in the data you collect on your day-to-day basis, you will inform intervention. If not, you're shooting in the dark. And one of the things I would encourage you all to do is to go buy my book, actually. No, think about brain processes the next time you're trying to figure out why a kid is learning or not learning. And if you do that, you can inform intervention. And that's the wonderful ideas behind what's happening at Arrowsmith and the wonderful work by Barbara and her colleagues, is they're thinking about brain functioning when it comes to intervention. We all need to be doing that. We all need to be focused on understanding child's brains so that the neurons that work together and fire together are the ones that stay together. Okay? Thank you very much.